you. Hypertension case finding is what we're going to cover next. Next slide, thanks. So this one here is an advanced service. So it's one that you could choose to sign up to, unlike DMS. And you'll either be signed up, individually as an independent or by your head office. It's a free service to patients, and it shouldn't be confused with any private services that you may have in your pharmacy for blood pressure checks. And there's two parts to it. So there's stage 1, which is identifying people at risk of hypertension aged over 40 and offering them the opportunity to have their blood pressure measured. That's a clinic check. And then there's stage 2, which is an ABPM being offered if a patient has a high BP reading at stage 1. The important bit here is that the ABPM is not optional. Every patient with a high BP should be offered and encouraged to have an ABPM, and therefore you must have that equipment available for your pharmacies. What we currently see from the data is that a large number of patients are not offered ABPM, and that some of those that are offered it and want it don't seem to get it. As with DMS, the programme team are now starting to look at the data in more detail, and they'll be contacting you if you're not delivering within terms of the service spec. I think more concerning for us as an LPC is that we're starting to see significant numbers of complaints coming in for general practice who are saying that pharmacies aren't delivering the service as it's intended. So please do be aware of that. Please make sure you've got the equipment, and please make sure you're carrying out both stages where it's required. One important patient safety point that's within the spec is that if a patient does fail to attend a scheduled pharmacy appointment to be fitted with their ABPM, the pharmacy team should make at least 2 attempts to contact that patient on separate occasions to rearrange the appointment. If the patient still fails to attend, the patient's GP practice must be provided with the initial results and notify that the patient failed to attend to be fitted with the ABPM. So that's really important, that if we've got patients there with high BP, that we've not managed to complete that ABPM because they've not turned up for an appointment, the GP is told that has happened. Next slide, please. So following a very high or high reading, patients should be referred to the GP for additional care. We recommend using PharmOutcomes to record all your provisions, because that will automatically send your GP notifications for you. And you should follow up with a GP by phone if a patient has a very high BP reading. Really important that those patients aren't missed. Next slide, please. This slide here covers the key actions that support service delivery. So first, please speak to your practices, make them aware that you're delivering the service and how you can work together. Make sure you've got all the required equipment available. Be aware of NICE guidelines for equipment, for BP readings, and for promoting healthy behaviours. Meet the IT requirements, including provider pays, and have a suitable layout of your consultation room. It means that blood pressure readings can be taken accurately. And finally, know when you need to telephone the patient to escalate them. Telephone the GP, apologies, to escalate them. Next slide, please. So on to promoting the service. Community Pharmacy England have made a range of promotional materials available, which you can use to display in the pharmacy. So there's a link there for you, and we share the slides later. There's also a pharmacy team briefing there to work with your wider team. And there's a virtual outcomes module that we've made available as well to support your staff. Try using some word of mouth to encourage your patients who've had a BP check to talk to their friends, relatives, etc. Provide them with a service leaflet that they can share as well. And use the promotional material in the pharmacy to start conversations when people attend for self-care advice or for buying OTC medicines, etc. Next slide, please. The final part of the service is the GP referral. So general practice teams can refer patients to a pharmacy for a clinic check or an ABPM. And these requests can be for patients with or without a diagnosis of hypertension. And these patients can be taking blood pressure medication. In Greater Manchester, GPs using EMIS can send referrals straight to PharmOutcomes. Referrals can also come in via NHS mail, a text to a patient, or any other arrangements that have been made between a pharmacy and a GP practice. All service provisions should be recorded on PharmOutcomes, either as part of the referral template or as a manual entry. And what's really important is that the community pharmacies and GP practices discuss how the service is going to work at a local level, and that GP practices understand the capacity you have to accept referrals. So if you can accept 10 referrals a week, tell them, let them know that you can do that. What we don't want them is only sending 1 or sending 100. It's really important that you have those local conversations, because every pharmacy will be different as to what they can manage within their general working week. Next slide, please. Again, the referral responses are really important, and similar to DMS, you've got complete now, accept and return. With hypertension case finding, we do see a small number of incorrect referrals, usually where it should have been a GPC PCS. And that's the practices that are using EMIS, who have got different buttons that they can refer to you using, and they just clicked on the wrong one. Usually it's a one-off, but if it does become a regular issue at your pharmacy from a particular GP practice, please do let the GPs know, and hopefully they'll work with you to resolve that problem. Next slide, please. And my final slide is looking again at some of the rejection messages that we've seen in PharmOutcomes. So patients not on BP medication is patients on BP medication is a common one. So the difference here is between the case finding and the GP referrals. Case finding, patients cannot be on BP meds, and GP referrals, they can. So a referred patient can be on BP medication. Issues with ABPM access is probably our biggest problem. We get lots of reports of ABPM's not available, or that our machine is broken, or we've no machine at all. If you don't have access to the equipment, firstly, if you're part of a multiple, speak to your area manager, try and source the equipment for your pharmacy. But if it's not available, and it's not going to be available for some time, you need to temporarily deregister from the service via NYS. Unable to fit patient to clinic, they can only come in the evening was one we saw, and we see others that are similar to this. It gave the right information back to the practice, but it could have been a bit more, you could have provided some more information there. So for example, if you know that there's a pharmacy providing the service locally, it's open later, let the practice know, make it easy for them, and work together so that we're getting the right patients to the right place. Closing in 20 minutes was a one-off, I think, and I hope. But unlike things like GPC, PCS, hypertension case finding referrals don't need to be completed the same day. In this case, the pharmacy could have contacted the patient and made arrangements for them to come in at a more suitable time. The next one was a little bit confrontational in the way that they wrote it. And they wrote, as we have said before, we currently do not have a pharmacy manager, so cannot offer this service. Now, what the pharmacy should have done in this instance is initially told that the practices that they couldn't provide the service, but they should have deregistered as well until the new manager was in place. Another one here around ABPM issues, that's patient going to a different pharmacy, there's no ABPM available. Again, to provide the service, you need to have the equipment in place, or you need to deregister. And the final one is no consultation room or private area. And what we know in GM is we've got a very, very small number of pharmacies who have an exemption from having a consultation room due to the very small size of their premises. Unfortunately for this service, a consultation room is required, and therefore the pharmacy would need to deregister. But like I say, that's very small numbers.